Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care, so that you have real control and so that you can influence decision makers even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another frequently question from one of our readers, and the question last week was: my dad is in intensive care on BiPAP for COPD. Should he be having a tracheostomy? You can check out the answer to last week's question by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer another question that we get quite frequently from our readers. And the question this week is: what's the average length of stay in intensive care after severe head or brain trauma, also known as TBI? Quite a large number of people come to IntensiveCareHotline.com, and they come to us because they have a loved one in intensive care who has a severe head or brain injury, also known as brain trauma or TBI, traumatic brain injury. If you want to know more about severe head or brain trauma or TBI, please check out our general section, and I put a link to our general section about TBI in the written version of this blog below this video. Now, most patients ending up in intensive care with a severe head or brain injury or brain trauma usually have events leading up to it, like a motor vehicle or motorbike accidents, they fall off a roof, they might be in a fight, and the list goes on. For anyone with a severe head or brain injury, the first life-saving steps are to be admitted to intensive care after they have been through the emergency room and or the operating theatre. Part of the first 24 hours in hospital or intensive care should also include a CT of the brain to determine the severity of the brain injury or brain trauma. Head and brain injuries come in different shapes and sizes, and once it's been confirmed that a severe head or brain trauma has been sustained, head or brain surgery might be one of the next steps to remove any significant bleeds, if possible, sometimes to remove parts of the skull, also known as a craniectomy, and sometimes to insert an EVD, also known as extraventricular drainage, a Codman's or an ICP monitor. In any due days after a significant brain trauma or brain injury include to maximize the chances of survival for your critically ill loved one, and that can sometimes be very challenging, especially when ICPs, also known as intracranial brain pressures, are high and elevated. ICPs are basically the pressure in the brain. If the pressure in the brain is too high and goes above 20 mm per mercury, there is a high risk of significant and also often irreversible brain damage. In order to achieve an ICP greater or equal to 20 mm per mercury, usually a minimum of 60 mm per mercury of CPP, which is also known as cranial perfusion pressure, needs to be achieved in order to achieve sufficient oxygen supply to the brain. The higher the ICP, the lower the cranial perfusion pressure or CPP, and therefore the increased risk of insufficient oxygen perfusion to the brain could cause irreversible brain damage. You can find more information about ICPs or intracranial brain pressure again in our general section, and I put another link to ICPs in the written version of this blog below this video. Other mechanisms to manage high ICPs are to drain CSF, which is brain and spinal fluid, also to give hypertonic saline, give mannitol, keep CO2 or carbon dioxide down by hyperventilating by using strong sedation and strong pain relief, as well as using specific sedatives for traumatic brain injuries such as thiopentone. Once all of these therapies have been maximized and hopefully ICPs and CPPs can be controlled and managed, then it will very often be a waiting game. And what do I mean by that? Well, critically ill patients with severe and significant head or brain injuries are some of the most difficult patients to look after, especially when they are not doing well, and ICPs and CPPs are difficult to control. Anytime ICPs are for prolonged periods, and in theory for more than 3 minutes, there is the risk for irreversible brain damage. Because of such a high risk for irreversible brain damage, intensive care teams tend to be very negative from the start, and they are therefore often trying to position your critically ill loved one's diagnosis, their prognosis, as well as their care and their treatment in a negative light, and they often hint towards withdrawing treatment as quote-unquote in the best interest for your critically ill loved one. With the negativity of the intensive care team, as well as with the positioning of the intensive care team very early on, the withdrawal of treatment or a withdrawal of life support might be quote-unquote in the best interest for your critically ill loved one. They're also implying that they don't want to exceed a certain length of stay in intensive care. Whenever the intensive care team says that they think that a withdrawal of treatment or a withdrawal of life support might be quote-unquote in the best interest for your critically ill loved one, they're in essence saying that your loved one's extended stay in intensive care is not welcome. You see, there are so many moving parts in intensive care, especially the parts behind the scenes that only insiders like myself know about. You and your family wouldn't have any clue about what a withdrawal of treatment and a withdrawal of life support for your critically ill loved one really means. From my experience, after nearly 20 years intensive care nursing in 3, where I literally worked with thousands of critically ill patients and their families, and where I also worked as a nurse unit manager for more than 5 years, and also now through my one-on-one phone or Skype and email counselling and consulting service for families in intensive care, the best outcomes for severe head and brain injuries are usually achieved when time, nurturing and world-class care are being provided in a positive environment. This in and of itself leads us much closer to our original question that I set out to answer, which was, what's the average length of stay in intensive care after severe head or brain trauma, also known as TBI? The answer to that question is really that it depends. If you are like 99% of the families of critically ill patients in intensive care who make no informed decisions, have no peace of mind, no control, no power and no influence, you will most likely don't question or second guess when the intensive care team is telling you that your critically ill loved one is having a poor prognosis and that it's quote-unquote in the best interest for your critically ill loved one to withdraw treatment or withdraw life support. Other statements that the intensive care team often uses to cement and support their positioning when it comes to a withdrawal of treatment or a withdrawal of life support after severe head or brain injuries or TBIs include statements like, your critically ill loved one wouldn't want to be a quote-unquote vegetable, or quote-unquote your critically ill loved one wouldn't have any quality of life. If you and your family are unprepared for any of the intensive care team's positioning of your critically ill loved one's diagnosis and their prognosis, as well as their care and their treatment, then the length of stay for your critically ill loved one will be short and the intensive care team will be in control, period. If you are like 99% of the families of critically ill patients in intensive care who make no informed decisions, have no peace of mind, no control, no power and no influence, you, your family and your critically ill loved one will simply stay at the mercy of the intensive care team and you will most likely feel intimidated by their perceived power and their perceived authority. The best outcomes for severe and significant head or brain injuries and the maximization of survival usually comes after sometimes many weeks, if not many months, in intensive care. I remember many years back when I worked in my first nursing job in intensive care, we had a young patient at the time who fell off a roof and he had significant head and brain injuries. He was in intensive care for nearly 6 months and it took a very long time for him to recover. He was extremely sick and he went through many trials and tribulations to leave intensive care alive eventually. He had prolonged periods with high IC. He went into kidney failure and he had to be dialyzed on a dialysis machine. But the bottom line was that nobody was ever giving up hope for this young man, and he eventually pulled through and got out of intensive care alive. He also visited the intensive care unit about 6 months later to show everybody that he's alive and well, and he wanted to show his gratitude to the people who looked after him. At the time of his visit, he was back in a job already and he was going to get married too. Therefore, the answer to what's the average length of stay in intensive care after severe head or brain trauma, also known as TBI, is very much dependent not only on the culture of an intensive care unit, but also on your mindset and also how much you buy into the negativity of the intensive care team. It'll also come down to how prepared you are to fight for your critically ill loved one, and it'll also depend on if you are doing your own research or if you engage a consultant like myself. Again, if you and your family are like 99% of the families of critically ill patients in intensive care, you'll make no informed decisions. You have no peace of mind, no control, no power, and no influence. And again, you are probably intimidated by the perceived power and the perceived influence of the intensive care team. If you are, however, in the tiny little 1% bracket of families in intensive care, you'll fight, you'll do your own research, and you'll seek out advice like in my one-on-one counselling and consulting service, and you simply won't take no for an answer. Therefore, the answer to my original question, what's the average length of stay in intensive care after severe head or brain trauma, also known as TBI, is an answer that you have way more control over than you think you have. If you do your own research, if you advocate for your critically ill loved one, if you're not intimidated by the intensive care team, and if you keep looking in how you can start managing the dynamics with the intensive care team, so that the intensive care team doesn't manage you. Usually, intensive care teams are the master at managing the dynamics with families in intensive care. And they know what to say, they know when to say it, they know how to say it, and they know what not to say to stay in control of the meaning and to stay in control of the outcomes that they want. The outcomes that the intensive care team wants is most of the time not aligned with the outcomes that you and your family want. The outcomes are dependent on the hidden agenda and on the things happening behind the scenes in intensive care. The your family want is to maximize the chances for survival for your critically ill loved one. Also, what does it mean for you and your family if your loved one is critically ill in intensive care with a severe head and brain injury or TBI? Have you given it some meaning? I hope you have, because the intensive care team will give it their meaning and you probably won't like it. The next, often life or death issue that families in intensive care are facing after their loved one sustained a severe head or brain injury or TBI is that once your loved one is coming out of the induced coma, that they may not be waking up in a time frame that is convenient for the intensive care team. What do I mean by that? Well, waking up after an induced coma can sometimes be prolonged, and waking up after a severe head or brain injury can be even more prolonged. And if the intensive care team thinks that your critically ill loved one is waking up in a time frame that's convenient for them, they again might tell you that a withdrawal of treatment or a withdrawal of life support is, quote unquote, in the best interest for your critically ill loved one. At the end of the day, if the intensive care team is not prepared to invest the time, the money, the physical as well as the emotional resources needed to get your critically ill loved one out of intensive care alive, the negativity will always be their fallback position. There is just too much at stake for the intensive care team, such as their financial budget, their bed management issues, their staffing and other resources, their medical research interests, as well as the politics, the hierarchies, the intrigue, the psychology, and the list goes on. Therefore, if the intensive care team has been negative from the start, which is very likely, and if they continue to be negative because your critically ill loved one is not waking up, you'd better be prepared and challenge the intensive care team. You also might want to check out an ebook that I wrote, which is the 10 things you didn't know about severe head or brain injuries, including TBI and stroke in intensive care, that you must know, especially if your critically ill loved one isn't waking up. So check out this ebook. I put a link below this video in the written version of this blog. Before I close this subject for today, I also want to quickly give you 2 examples from my own inner circle, where my cousin's husband many years ago endured a severe head and brain injury, and he spent many weeks and many months in intensive care and rehabilitation, and yet he's ever so grateful to be alive. Another friend of mine that I used to go to school with also sustained a severe head and brain trauma, and he was in ICU and rehabilitation for many months. Again, if he didn't get good care, treatment, positivity and nurturing, he wouldn't be alive today. Both are prime examples that the length of stay in intensive care matters, and not giving up and not taking no for an answer matters as well. The question really is, will you and your family have the intensive care team dictate to you how long your loved one is to stay in intensive care after a severe traumatic brain injury, or will you be calling the shots? So that's it for today, and the question is, how can you become the best advocate for your critically ill loved one, make informed decisions, get peace of mind, control, power and influence quickly whilst your loved one is critically ill in intensive care? You get to that all-important feeling of making informed decisions, get peace of mind, control, power and influence when you download your free instant impact report now by entering your email below. In your free instant impact report, you learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free instant impact report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free instant impact report now by entering your email below. In your free instant impact report, you learn how to speak the secret intensive care language, so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care, and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage this in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also check out our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Or you can call us, find international phone numbers on our contacts tab. Also, check out our ebook section where you get more ebooks, videos and audio recordings, and where you can also get one-on-one counseling and consulting with me via Skype over the phone or via email by clicking on the products tab. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.